Okay, we're live. Hello. Hi, guys. How are you doing today? Let me just pop this mic on. How are you all doing today? Welcome to today's chit chat on hormone balance. Good to see you. Good to be with you. I hope you're all well. I hope you're all doing well. Thank you for joining me again on this lovely Sunday afternoon. Well, it's afternoon where I am, but wherever you are, hi. And we're going to be talking about hormone balance in a moment. But yeah, this is a great weekend for me because we are just reaching. Oh, by the way, hi, I'm Dr. Sylvia, founder of AskAwayHealth and a general practitioner. And if you've been on with us for a very long time, then you know that this is a special week because we are nearly at 20,000 subscribers, which is really exciting for me. I don't know if we're there yet, actually, but I think we're just either a few subscribers there, or actually we might be there as I'm speaking, who knows. But yeah, I'm really excited about that this afternoon. And I'm pleased if you're joining me. We are celebrating hitting 20,000 subscribers on YouTube this weekend. But yes, on this channel, we like to talk about everything related to our health as women, sexual and reproductive health, our family's health, and all that. So if this is the kind of information that you're looking for, I'm really glad that you stopped over to talk about hormone balance issues. And really, what I want to address is the expectation around dealing with hormone imbalance, because I think it's a really big topic and something that lots of women are going through. And it's one that there is no one size fits all, which is part of the problem. Getting the diagnosis is tricky for some women. And then when you get into the treatment, what do you expect? Is there a specific time? It's one of those tricky conditions or situations because it can be caused by several different conditions, as you're going to see in a few minutes. So that's the topic for today. Thank you so much for joining. If you're watching on the replay, please give this video a like. And thank you so much for all your support. I really appreciate you, particularly this weekend that we're talking about hitting 20,000 subscribers on the channel. So I wanted to talk about this because I've come across a few patients recently where issues around hormone balance have come up or are at the crux of their problem, and the concerns and the expectations. And I know that everyone has a different need. And I thought that having a talk about it or providing information will help to support women, might support you if you're going through something similar. So I'm going to be looking at some common examples or conditions where women will experience hormone imbalance and talk about a few things that we do to restore balance. Not everything, because it's an individual situation and each of those conditions will deserve their own separate videos, but it's an overview on hormone balance and your journey as you progress to restore hormone balance, what to expect during the recovery process. So let's just get started. Let's jump in. If you're watching live, please let me know where you're watching from. Say hi. It's really great to have you on board, and give this video a like, please. Don't forget to do that for me. So we're looking at hormone balance. I've got a few different images here, different situations that we're going to be talking about in a moment when a woman is experiencing hormone imbalance. It can manifest in so many different ways. It can impact physical and emotional well-being. So it's, one or the other, even a combination. Many women go through pregnancy. That is one of the most common periods of hormone imbalance because when you're pregnant, some hormones are higher than the other. For example, because the hormones of pregnancy are trying to support the baby, your stomach and bowel hormones may take a little break, or they are not being produced as much, or their effect may not be as much as they would be normally. So some women as a result experience constipation or heartburn because they're pregnant. That is one example where you can have hormone imbalance because of a natural event, you're pregnant. But there's so many other things. Puberty is another scenario where you have hormone imbalance and so on. So let's talk about a few specific conditions where this might happen. Let us begin with let's start with, let's not start with menopause. Let's not start with that one. I thought I'd primed all my different videos. Well, why not? Let's start with, let's start with menstrual irregularities. Let's talk about menstrual irregularities. They can happen at puberty, and usually will settle down. So for example, when a girl starts her periods, you might expect for the first few months or even up to a year that she would have irregular hormones. And we don't get worried about that, because unless it's very unless it's extremely distressing with very heavy bleeding. But usually it will tend to settle down within a few months to a year, thereabouts, for many girls. But all that is happening because their hormone levels are out of balance, and it's just taking some time to get into an established pattern that they will continue throughout their reproductive life. So this can happen. Menstrual irregularities happen at puberty, but you can also have it from different conditions like fibroids or endometriosis, where you get very long or irregular cycles, heavy bleeding or even scanty bleeding as an alternative. So that's one example where you might have heavy or irregular periods or menstruation, and that's a good example of hormone imbalance. Another one which I would love to talk about is one that many people are probably familiar with. I'm so sorry, I'm mixing up my different slides. I haven't arranged them beforehand. But the next one is PCOS, which is polycystic ovary syndrome, which many of you from the channel will be familiar with. I talk about it a lot. I haven't got a playlist yet on it, but I have a lot of videos dedicated to it. So please just search through women's health and reproductive health playlist, and you will find our PCOS videos. But with PCOS, abnormal cysts develop in the ovary or the ovaries and affect their function, including producing hormones. And women with PCOS will have a range of different symptoms, including abnormal periods, irregular periods, and there may be periods that are scanty, there may be very heavy periods, there may be very, very long intervals between periods, so very irregular periods. And they have higher testosterone or high testosterone level compared to normal. And of course, I've mentioned that they can develop cysts. Another thing that is sort of may be related to menstrual irregularities is that women can also develop premenstrual syndrome, and you'd have heard of premenstrual syndrome or PMS, which is a group of symptoms, physical and emotional symptoms that a woman can experience days, some of us even up to weeks before our period, where we might go through mood swings, experience very extreme tiredness or fatigue, bloating, sore boobs, sore breasts. These are the kind of things that women might experience during that time. And again, it's because of an imbalance of hormones. So if you're just joining, hi, we're just talking about hormone balance. I am getting to the point of the video, which is what expectations are around hormone imbalance, but I just wanted to talk about a few conditions that we should remember are associated with hormone imbalance. So the next one is thyroid disorders, which you are probably familiar with the underactive or overactive thyroid. So basically, when the thyroid gland is not functioning as it should, it could happen from birth, or it might develop later, maybe part of an autoimmune condition. When you have an underactive thyroid, the thyroid is not producing enough hormones. And some of the symptoms may be tiredness, being very sensitive to cold, so feeling very cold when everybody else around you is hot, gaining weight, sluggish bowels and feeling constipated, and depression. Many of these symptoms develop quite slowly, so a person may go through these things and not realize it has something to do with their thyroid gland until we do a blood test and it indicates that it's a thyroid problem. So on your screen, you can see my image of the thyroid glands, which are located in the neck. And if you have an overactive thyroid on the other hand, so you have the hormones being produced excessively, and some of the symptoms there will include things like feeling very anxious and irritable, an inner restlessness, not feeling calm, nervousness, trouble sleeping, trouble settling down and sleeping, and perhaps changes in the menstrual cycle. So as I said, I'm just going to brush through some of these. These are by no means the only symptoms, and I'm just trying to give us specific examples of some common hormone imbalance situation. So we've talked about menstrual irregularities, we've talked about PCOS, and we've talked about thyroid disorders, we've talked about PMS as well. So the next one I want to look at is menopause, which of course is another hormone imbalance situation where a woman reaches the end of her reproductive years, the ovaries are not producing reproductive hormones anymore. And of course, you would have heard of some of the very common symptoms like hot flashes, night sweats, mood changes, forgetfulness, and some of the things that women will experience with menopause. Now, there is also something I wanted to touch on this because it's a relatively new concept known as adrenal fatigue. You might have heard of it. Let me know if you have in the comment section. And I wanted to just clarify what it is. It's not particularly an accepted medical diagnosis in conventional medical speak, but it's something that those who believe in it as a condition consider it to be a mild form of an actual medical diagnosis, which is adrenal insufficiency. So we have adrenal insufficiency, which is a recognized medical condition where your adrenal hormones, and I'm just showing you an image of the adrenal glands, which are usually located above your kidneys. So you can see those sort of triangle-shaped structures on top of the orange kidneys. These are the adrenal glands, and they produce a raft of different hormones. And so when somebody has adrenal insufficiency, they're not making enough hormones. And that may be because of some disease, or maybe they've had surgery. And you can actually make a diagnosis of that condition with blood tests and other special tests. But with the one called adrenal fatigue, it's thought to be a mild form of adrenal insufficiency that is brought on by chronic stress. And generally, it's used to apply to a collection of non-specific symptoms, like if somebody comes and they have different symptoms like body ache, feeling very tired, nervous, trouble with their bowels, poor sleep, symptoms around that. And so, it's not something that, like I said, it's not something that's accepted as a medical diagnosis in medical circles, but there are some people who are concerned about adrenal fatigue and the possibility that their hormones will be out of balance, and that is why they are going through these symptoms. So those are just some examples of conditions where you have hormone imbalance. And I wanted to just look at, with any of these cases, of course, the treatment approach is different. The treatment approach is different for all of them, as you will imagine. Treatment for menopause will not be the same as the treatment for thyroid disorder. But what we would expect is, if a person or a woman is diagnosed with one of these conditions, to first of all approach your medical practitioner to get that diagnosis right. So if you have any of these symptoms, or if you're not feeling well, the usual important thing is to speak to a medical practitioner to make sure you get the right diagnosis before you embark on different types of treatments. So we may want to offer tests for you to find out what is responsible for your symptoms. And if it is determined that there is an imbalance of the hormones, then it may be that you're looking at hormone replacement, depending on what the condition is. For example, if you have an underactive thyroid, the treatment is hormone replacement, replacing the thyroid. So the person will be on thyroxine for life. But there are other things that could help. With when somebody's experiencing hormone imbalance that can contribute to overall well-being. So one of them, of course, is what we eat. More and more these days, we are appreciating the value of diet. We're appreciating how important it is what we're eating is in terms of our overall health. And while I'm not saying that by any means any specific food will cure a particular medical condition, we do know that the nutrients in the foods that we eat can contribute to battling inflammation, contribute to battling oxidative stress, and promote overall well-being. So we're looking at usually diet that's rich in whole foods, lean proteins, healthy fats. So, like plant fats, for example, avocado, olive oil, fatty fish like mackerel and salmon, complex carbohydrates, and of course, cutting down on processed foods and refined sugars. Those are the kind of things you'll be wanting to do to boost your nutrition, to support your well-being, even if you're taking replacements. So even if you're menopausal and you're having to take HRT, for example, you can also look at your nutrition as something that will help to boost and improve your general well-being. Another thing is exercise. I just love I picked this particular clip because I just love the kind of wanting to leave your responsibilities behind, because sometimes we're also busy with work, we're so busy with different responsibilities, looking after children or other family members, and so many different responsibilities in the world today. And we don't often find time to just be a child again, just sort of play with, without your shoes on, just enjoy nature. But anyway, regular physical activity like yoga, if you're into yoga, walking, if you're into walking, swimming, if you're into the gym, and just engage in activities that will keep your body moving, because that also has benefits, not just for your physical body, but your mental state. They can help to reduce stress levels. And then, of course, talking about stress, that is something that we have to address if you're looking at balancing hormones. That's something that's really important that you want to tackle, because we know that stress can impact your physical health, and it's a cycle that goes round and round. So practicing mindfulness and meditation techniques, getting proper sleep and relaxation, and sleep we cannot emphasize. I know that when there was a period of time just after I'd had my daughter, my sleep was rubbish, and I actually fell ill as a result, just because of bad sleep. So you can't, and I can never overemphasize, even if we give you the prescription or we give you the medicine, if your sleep is rubbish, it affects everything else. Poor memory, poor motivation, fatigue, weight gain, the works. So sleep is really important. Okay, so we're going through my list. If you're just joining, thank you so much for clicking onto this video where we're talking about what to expect if you're on the hormone imbalance or balancing journey, which a lot of women are. We as women, you go through, whether you're menstruating, or you've gotten into menopause, your life really is about hormone balance. If you think about it, we're balancing hormones nearly every month. You don't have to have a condition like an underactive thyroid as a woman before you're involved in balancing hormones month after month after month. Then by the time you get to menopause, more hormone fluxes. So we really have to keep a very close eye on what we're doing with our bodies. We've talked about the need for hormone replacement. If you need to get that, by all means. We've talked about exercise and diet or nutrition. We've talked about stress. And there is some room for herbal therapies. I know some of my ladies are really keen on non-conventional treatments, and you might find benefits from herbal supplements like chasteberry, black cohosh, lavender, ginger. Speak to a healthcare practitioner before you engage in those. Make sure you talk to somebody, especially if you have other medical conditions and you're taking some other prescribed medicines. People always think that if they're taking herbs or natural therapy, it doesn't have any side effects. That's not true. They could have side effects, and they could also interact with the medicines that you're taking. So we've looked at some common conditions where you could get hormone imbalance, and we looked at some of the different treatments that you may have, because we're all different. It might be different from one person to the other. I've just looked at an overview of some of the things that might happen. So if you're just joining, thank you so much for popping in. Let me know what you think. What was your experience? What was your hormone balance journey? How did it go? Were there delays in your diagnosis? Was it difficult to work out what was going on? Did you have a family history? Are you somebody who decided not to go the route of traditional medicine or conventional medicine, and you wanted to rely on herbal treatments, diet, and lifestyle changes? Tell us what your journey was. And especially if you're watching on the replay, please let me know how it went. So now I want to look at what to expect when you're on this hormone balancing journey. So whether you are menopausal or perimenopausal, whether you're having menstrual irregularities and you're working with your practitioner to reverse those irregularities, whether you have PCOS, if it's thyroid or adrenal fatigue, or any situation or condition where there is some imbalance and you're not feeling well, what do you expect as you start taking the treatment? One of the common questions that women will ask is, well, how long is it going to take? How long before I start to feel better? And I think it's really important. Let's be very realistic and practical. These are gradual changes. Restoring hormone balance takes time. Okay, guys, if you're just joining, please give this video a like. I'd really appreciate it. And I'd love for you to comment and interact as well with me. So it can take time to restore hormone balance. Let me give you an example. Somebody with an underactive thyroid who has to start taking thyroxine. You're not going to start getting the full effects from the first or even second or third week. Usually it will take months. So perhaps by 3 to 6 months, you may find that your hormones, because you're taking the thyroxine, have come up to the level that's supposed to help to keep you well and keep you functional. So that means you do need to have a lot of patience, and that also applies to almost all the other conditions where you have a hormone imbalance. That things aren't just going to happen like that. They will take some time. So you really need to be patient. But understanding the condition, understanding the treatment and the goals of the treatment, I think will help to encourage you to stick in, to keep on going. And what else would help is making sure that you're eating foods that will help to boost your overall health, undertaking or undergoing exercise that would help to boost your production of happy hormones, your endorphins, that will put you in a good place, a feel-good place while you're waiting for the hormone balance to happen. The other thing that, of course, women want to know is how soon are the symptoms going to get better? How will taking the hormones actually get rid of the symptoms? Usually that is the case, because as the imbalance is reversed, because since they were causing the symptoms, as the imbalance is reversed, the symptoms should settle down. So you may find, we talked about some of those things with thyroid, for example, constipation, not able to tolerate heat, nervousness, depending on whether it's an over or underactive thyroid, depression. A lot of those things will reverse. So you have less pain, your mood is better, you're not feeling as tired as before because the hormone levels are coming back up to normal. Now, that's the second thing in terms of what to expect, that your symptoms will improve. What about comparing yourself with other people? I can't think of a better way to say it at this point. Your recovery is individual. I know of somebody who, after we started them on a particular treatment, came back after a couple of months, and her friend had gotten really better, gained lots of benefits from a particular treatment schedule, but she didn't, and at least not at the pace that she would have expected. Well, the thing is that we have individual differences. So it may be that your friend or sister or whoever has a condition that you don't have, or you have a condition that they don't have, and that may explain why they responded in a different way to the way you responded. Or it may not even have anything to do with conditions. We are all different, and so your personal journey is unique, and what works for you may not work for me or somebody else, even though we're taking the same medication. So your doctor will tell you, well, don't take somebody else's medicines, and that's kind of story. That's why, because we all have individual responses. And the other thing in terms of your expectations are, get used to a change in your lifestyle. You need to become, something needs to give. Okay, if I was going to run an Olympic marathon, I'm not, but assuming I was, I would have to make some changes in my current lifestyle. I'm going to have to look at how to get up early in the mornings and go to the gym and practice and practice and practice. I'm going to have to change my diet and, all the things that I would need to do to perform effectively and to do well as an Olympic marathon runner. And so similarly, if you're somebody who has to go on a hormone balance journey, there may be some things that you have grown up doing, or that you become used to doing, that were part and parcel of what you were before your diagnosis. And in order to make the change and keep the change, to maintain the change, you may have to completely overhaul the way that you used to do things. And it may be simple things, simple habits. We've talked about the exercise, we've talked about the diet. So perhaps, the way that you guys cook food at home has to change. You need to get into a gym habit, or get a body that you're going to have regular sporting activities with. So different things that you want to change to maintain that balance. Let's look at menopause, for example. Many women think that with menopause, and by the way, not every woman with menopause will have distressing symptoms. Many women go through menopause, it is a transition, and they don't have issues, just like many girls go through puberty and you don't hear stories of menstrual problems. But if it's a woman who is menopausal and is struggling with symptoms, and we're looking at hormone balance, some women just think, oh, it's the HRT and everything will be done. Actually, the studies tell us today that you can take HRT, but also doing things like lifting weights to help to build and maintain the strength of your bones, help to build your muscle mass, looking at your diet, improving your sleep. So putting in a few habit changes will actually help to maintain overall health, even while you're taking the HRT. So that is how to sustain, whatever benefits you're going to get along your hormone balance journey. And I think that will, I really think that will, for many people who are interested in doing that, in learning what else can I do to support myself, and what should I expect as I go along. Don't think that once you finished having the hormone replacement, it's done, you can go back to what it was. No, it's a journey, and that journey comes with making a few changes that will help you gain the best out of it as you return, or as your balances are restored. So my friends, thank you so much for listening this Sunday afternoon. Great to spend some time with you. We've covered today hormone balance, some conditions that are associated with hormone imbalance in us women, some of the treatments, and what to expect as you go on your hormone restoration journey, your hormone balance restoration journey. Please give this video a like. I'm really pleased you've joined me. I don't know if we've reached 20,000. I've not checked my phone. I think, because before we started, I think we were just 10 away. I'm so excited about it. Let me just have a quick look, because if we have, then you'll be the first to hear just after me, if we have got to that point. So let me have a quick look. But yeah, I just want to use this opportunity to say thank you so very much to all the subscribers. I think we are, let's see. Okay, we're still 8 people. So if you're just watching this and you've not subscribed, come on, subscribe, please. Let us get to 20,000 subscribers this Sunday afternoon. But no, seriously, thank you so much to everyone who is a subscriber to this channel. I remember when it was 200 or 250, and I never thought I would get to 20,000. But that just tells me that we are producing information that you find useful, that you love what we're doing, and the support and encouragement is very much appreciated. Don't forget that we've also just turned on channel memberships for this channel. So if you want to join the channel, learn what we do in the back end, suggest topics that we cover, we're all about health education, please come and join the channel. There are different levels for, based on what you can afford, but every little drop is so much appreciated. All right, guys, thank you so much for watching, for listening. I hope you have a lovely Sunday. I hope you have a lovely week. I am coming back in about 40 minutes. Is it 40 minutes or maybe 30 minutes? I'm coming back because I want to talk to you about birth control and depression. Some findings from a new study, which I thought were interesting. So come back if you're interested. We're doing Watch This Space in about 30 minutes or so, or 45 minutes. I think it's about 4:30 that it's coming on. Yeah, to talk about this, see what this new study has found. If you're interested in that, I will see you again soon. Bye-bye.